Hey guys, welcome back to the channel. This is Side Dental Vlogs, and today's topic will be on re-RCT. Many a times we often encounter cases like we have done the RCT, and maybe after 6 months or 8 months back, the patient comes back at your clinic, and the patient complains of pain. And when you see the root canal, everything is fine, everything is perfectly obturated, and still there is some periapical radiolucency. And at that time, you get perplexed. Okay, what shall I do now? So whether you should do the re-RCT, or whether you should extract the tooth, or whether you should charge from the patient or you should not charge from the patient. So what is the protocol, what I do in my clinic, and I want your views as well. So I did a root canal in one of my patients, and the root canal was perfectly obturated with a zirconia crown. And patient came back to me after 3 years, and the patient had a periapical lesion. It was not that big, but it was small lesion which was developing in the distal canal of the tooth. So I gave the patient antibiotics, and at the time of the root canal, I remember I had taken a lot of time, and it was like a lot of irrigation and a lot of work on the patient, and I did it perfectly fine. But we cannot guarantee anything on the human body, because the patient may develop diabetes over time, or the patient may have uncontrolled diabetes, or may have some other medical conditions. So I said to the patient ki you can take these medicines, and if you want we can remove the tooth, or we can place an implant, or if you want I can try an RCT, but that will be little bit chargeable. So the patient agreed upon saving the tooth and retrying the RCT. And see, we have to convince the patient for these things, because suppose patient comes back to you, and in case the patient charges you, many times it happens, out of 10 patients, 2 patients they'll say, what RCT you have done, you gave us guarantee, and the crown is okay, but the tooth is not fine. It happens in practice even if you do the best RCT. So at that time you have to make sure, assure the patient key that this is not a problem which is gonna take your life, and I'm gonna treat it. There are many other ways we can either place a bridge, or we can extract it and place a new implant over there. You can give some offerings to the patient, like some kind of installment scheme for the implant if the patient is not that much affordable. So what I did is I took out the crown using a crown remover, and after that I took out the glass ionomer cement filling which I had done for the patient, and I only did the re-RCT of the distal canal. I didn't touch the mesiobuccal and mesolingual canals, and kept the tooth for 2 months under observation. I put calcium hydroxide in the distal canal, and waited for 2 months. After that, I obturated it. After that, I put a temporary crown on the tooth. So what was like loss for me, I had to work on the patient for 5 6 times. I didn't charge the patient, but at the end of the treatment, I when the tooth structure was gone, like there was a lot of cutting involved. So I tried to place the old crown which was not fitting, and I told the patient that you have to pay 50% of the crown price. So this patient, I didn't gain anything, but I gained a lot of experience, and I gained a lot of confidence from the patient. Means the patient was happy in the end. Initially, he was a little bit annoyed, and he's very like close to me also. So I don't attempt in all the cases. A guy who is polite, a guy who is humble, a person who is very kind. Okay, I do this kind of treatment on those patients only. But if the patient is very rude to me, and I feel like he's not gonna get satisfied with whatever I do, and क्या होता है ना, it's like you should have enough feeling to do that. Oh, this guy is genuine. I should really try to help this person out, because somehow maybe there is some mistake at our end or the patient's as well. So but we should try to help the patient. Okay, but if the patient is very rude, what I feel ki, if the patient doesn't want to get treatment, I usually extract the tooth, and leave the patient and tell the patient to keep a bridge. But the patient compliance is very much necessary in these cases. See, it's not either the fault of the doctor or the patient. It's just luck, or it's some kind of body immunity which is causing this problem. and you have to make tell the patient in confidence, keep the patient into your confidence. That is very much required. Convincing you should do. You should not be like, no, ab jo ho gaya, isko nikal. It should be a little bit more convincing when you say to the patient, and give other options to the patient. We can do this or we can do that. And sometimes it's also not possible to do the re-RCT, because even if you apply a lot of neosol, I use neosol and GP solvent, sometimes even if you call the endodontist, the root canal goes into failure. And it's always not like if you call an endodontist, the root canal is going to be successful. So you have to try. But in the case of if you call an endodontist, then you have to pay the endodontist as well. So dentistry is not about perfection. Dentistry is about how you manage things. You cannot do every time a perfect case. Sometimes you botch up cases, sometimes we do a good cases. So it's not like every time you can do a best case. We have to give you a best, but it sometimes doesn't happen. Sometimes things go haphazard. It doesn't happen your way you want. So it's not, but you should learn all the work, but you should also know to manage it properly. So that's what I have learned in all my years of practice. How to manage a case and how to manage a patient. That is the most required thing. And good medicines as well. You should have a good knowledge of medicines. So in case of pain, you can write the medications to the patient. Thank you. That's all. I wanted to share this thing with you. So if you want to follow me on Instagram, you can follow me in Sai underscore dental. Till then, take care. Bye bye.